paroxysmal supraventricular tachycardia in under 10 minutes. As far as symptoms go, the patient will report palpitation, may even see some syncope. Diagnosis: EKG is your gold standard. Okay, let's talk about the treatment here. So the first question you should always ask yourself is this patient even stable? And of course your answer is yes or no. If the answer is no, direct current. So we're done there. Now, if the answer is yes, they are stable, then your next question is, after getting an EKG, is the QRS narrow or wide? So here we'll put narrow complex tachycardia and a wide complex tachycardia. So in a wide complex tachycardia, there's a couple of medications you can use. You can use something like lidocaine. You can use procainamide. But really, the one that gets tested the most is amiodarone. Now, in a narrow complex tachycardia, you again have a couple of options. But usually for test taking strategies, you always want to go with the most minimally invasive or inexpensive, and that's going to be a Valsalva, which is to bear down, or a carotid massage, and your next question should be, did this maneuver work? Of course, your answer is yes or no. If the answer is yes, then all you're left to do is observe. If the Valsalva or carotid massage did not work, then adenosine is the next drug of choice. It's either a Valsalva or a carotid massage. Once one of them does not work, you move on to the next step. You do not keep trying to attempt to correct the problem with these techniques. As far as buzzwords go, this one is kind of a long stretch, but it's always helped me remember the use of amiodarone in this setting. So if you look at the three letters within the word that I've capitalized and underlined, in medical terminology, meiosis means to constrict. Like a myotic pupil is a constricted pupil. So whenever I think of a wide complex tachycardia, I want to give something that will constrict, per se, the QRS. And that's how I remember amiodarone and its application for PSVT. I hope this helps. Okay, so let's take a look at a vignette. An 82-year-old patient with a history of PSVT presents with a rapid heart rate that did not respond to repeated Valsalva maneuvers. Which of the following measures should be used next for conversion? So looking at the answer choices, carotid sinus massage could be a potential answer for the exception that we've already tried Valsalva maneuvers. So, as far as test taking strategies go, you should technically move on to the next step as these non invasive, inexpensive maneuvers have been attempted, in this case repeatedly. A cardioversion is not necessary unless they tell you within the question that this patient is unstable. Something like a hypotension or ill appearing patient. So we're left with two possible answer choices. We have B and C, adenosine and amiodarone. So if we remember, amiodarone is a medication that is used for wide complex tachycardias, and adenosine is used for narrow complex tachycardias. Being that a Valsalva was attempted, we have to assume within the question that this patient is stable with a non-complex tachycardia where a Valsalva maneuver has not worked. Adenosine is the next best step. B is the better answer choice here. Thank you.